On these next few slides, we're going to talk about how to fit the lens edge of the Onefit Med. So it's important that we control edge alignment. As you can see from this image, this is a nicely aligned edge. It's not digging in and not lifting off on the conjunctiva. So the edge is called the E value, and it can be adjusted by 250 microns positively or negatively. So if we add edge lift, this lifts the edge off of the conjunctiva. If we decrease or reduce edge lift, it brings it in closer to the conjunctiva. So the fitting sets that are supplied have a toric periphery on this outer edge E value. So there are several reasons why we would need to use a toric periphery. If we have an inferiorly decentered lens, often this is because the inferior sclera is steeper and we'll need to tuck that edge in, so we'll reduce the E value. Sometimes the tear layer can fog up, as generally called midday fogging, and the cause for this can be the lens rocking on the conjunctiva and squeezing those goblet cells. Another reason to have a toric periphery is if we have superior lift-off, this can often cause lens awareness, which is uncomfortable for the patient. If you find that you have some odd sill at an oblique axis, this can sometimes be due to flexion. The way to check for this is to put the patient onto a topographer or a keratometer and just check, and if the front surface of the lens is not spherical when it's on the patient's eye, then it's flexing, and we will need then to make sure that there is a toric periphery installed. At any point we have to manufacture a lens with the front surface toric, we'll need to have a toric periphery to stabilise this. And finally, a controlled peripheral recess or notching. So if you need to notch the lens to allow for a glaucoma shunt or a pinguecular, we'll also need to put a toric periphery on. So there's been lots of research done by Badletz, Baumer et al. And A. van der Warp on scleral toricity, and we know that superior nasal is generally flatter than inferior temporal. And you can see this is borne out by the figures on the diagram. This is an image that's showing how a decentered lens inferiorly can create some toricity. So you can see on the left-hand image, the lens surface is nicely aligned with the corneal surface, and essentially there's a plano tear layer. The image on the right is showing some variation in the tear layer thickness. So this may create some toricity and also possibly some base-down prism. Another reason to use a toric periphery is to determine the orientation of the controlled peripheral recess or notching. This is useful for pinguecular or glaucoma shunts. We need to know where the flat axis aligns in order to create the notch at the appropriate orientation relative to these flat marks. So the toricity will be placed as before, and using the online tool we will put the peripheral recess at the appropriate angle to the flat marks.